and Director of Proud Mary Consulting. So Michael works with clients to understand their environment, natural resource and climate risks and opportunities, and to create valuable strategies in response. Michael brings deep experience in navigating government, as well as shaping and working within institutional and regulatory frameworks. He is sought out for his ability to contextualise complex policy issues and articulate strategies to a wide range of audiences. Michael has over 20 years' experience in public policy design and delivery. He has held senior roles in the Victorian State Government in water and climate change, and that includes as the Director, Climate Change Policy, and also Director, Water Sector Governance in the Victorian Department of Environment, Land, Water and Planning. Everyone, please join me in a warm welcome for Michael Wheelahan.
Thanks very much for the opportunity to come and talk today. First thing I'd like to do is also to acknowledge the Wurundjeri people as the traditional owners of the land upon which we meet and pay my respects to their elders past and present. And when I do that, I like to think what relevance that has to what we're talking about today. And the first thing that I note is that the Wurundjeri people and their civilization managed to exist on this continent for tens of thousands of years without causing any perturbation to this atmosphere. And so there's a huge connection, I think, with what we're talking about today. And at the same time, they dealt with some very significant natural changes to the climate, including being able to walk to Tasmania in the fairly recent history as far as Aboriginal history goes. So that's my reflection on that acknowledgement to those people today. What I want to do, the topic of today is about energy and water planning. So I'm going to talk about that in a pretty broad context, starting at a high level, coming down to, I guess, Victorian scale, and then down to Western health as an example of energy and water planning, to show some of the challenges that we've got if we want to meet our state objectives for achieving water security and eliminating emissions, along with keeping our health and hospital services going. So I started with this picture because you've all got the program. It's got my name on it and what I'm here for. So I don't need to tell you that. And we're talking about the atmosphere and our interaction with it as a species. So that's why I've got this beautiful massive picture of the Earth here. And if you look closely in the top left corner, I think you can see Western health. So keep looking, you've got another moment. But as a species within that atmosphere, I'm just looking for the page down, thank you. There we go. Thanks very much. When we think about the interaction of climate and health, quite often we come up with a picture like this, an horrendogram, such as this, that shows a lot of the complexity of the interaction of climate and health. This is from the Lancet's program on climate and health, showing how complex all of those interactions are. And again, I think the point that I want to make in relation to this here today is that at the same time as we're trying to reduce emissions and water use in our health services because of the threats of climate change, we are seeing an increase in the demand for our health services from the same effects of climate change, which is only going to drive that water use and emissions up. That's a conundrum, but it's an old one in other respects for health services, because our focus and our spending on health protection and on ill health prevention has always been the poor cousin to acute health care, but it becomes even more important now. And we've been talking about designing environments in which people are comfortable in hospitals, designing environments in which people are comfortable in other buildings and out in the open is going to be increasingly important to reduce the demand for health services that occurs as a result of that changing climate that we're experiencing. So the complexity of what we're talking about is huge in a lot of ways, because this environment that we're influencing is going to make us more and more sick and put us in hospital more often. So what's going on in that respect in Victoria? Well, here's a little bit of good news. The Victorian Public Health and Wellbeing Plan for 2019-2023 has, for the first time, included a focus area tackling climate change and its impacts on health. 4 years ago, the previous Health and Wellbeing Plan at the state level, it did mention climate change, but it really just mentioned it. It was barely there at all. It certainly wasn't a focus area. So a lot has changed in terms of understanding what climate change is going to mean for health, and as a result, focusing on climate change and its impact on health is going to start reducing that demand for hospital services that is arising and is going to continue arising from a changing climate. So there's a little bright spot in all of that. Mind you, there's one page on it. That's it. There's the text on the climate change focus area. So there's a lot of work to be done to say, well, what does that mean for the health system and the health sector? But it's there. We started. So I said I'd talk a little bit about the broader context for water and energy planning. I want to highlight with this slide here where we are in Melbourne's supply. This graph here shows on the horizontal axis time out to about 2065, and on the vertical axis the average annual demand in Melbourne for water. And it shows the wide range of possibilities for increases in demand, mostly due to increases in population size, but also due to a lack of progress in making our use of water more efficient. And in the blue area there, it shows the potential reductions in supply that we're going to experience. And that supply includes the large amount of supply that we can now receive from the Victorian desalination plant. And what it shows here, and I've added this red line because I think it deserves a red line on this graph, is that the earliest period at which we might see a crossover of those is actually 2028. So we're only 9 years away from the period when we may need a large augmentation for Melbourne's water supply. So that's not very far away. Now, it could be as far away as the middle of the century. This is one of the challenges in planning for water supplies. There's a huge amount of variability. But this was 2015. We're 4 years later. We're tracking pretty much on the worst case scenario in that now. Okay, and it's and that's where we are. So it may be less than a decade, and we're saying, okay, do we flange up the next big part of the desalination plant, or do we do something else? So that's very significant context. I pulled this page out of Western Health Sustainability Report, and I'm looking there at the blue bars. And the water consumption from Western Health over those periods, despite a growing population, is pretty flat. I think that's pretty good. But it's not going to help when we're actually running down on water. So I don't quite know what the next stage is. I think I do with energy, but I don't quite know what the next stage is here in terms of water efficiency or reducing water consumption for Western Health. But our pressing on the issue of water efficiency and the use of alternatives has to be strengthened and reinvigorated if we're going to make our contribution as a health sector, as a significant water user, to maintaining water security here in Melbourne or anywhere else in the country for that matter. Because, you know, we're actually not badly off as far as water goes in Australia at the moment. So that's just a little bit of context on water. Flatlining perhaps on use, and we're on track to running low potentially within a decade, and that's going to be a big deal. I want to talk a little bit about energy, but I think about energy pretty much only in relation to emissions. So I was pleased to hear the discussion from the National Construction Code saying, well, we're less worried about energy. the real thing is the emissions. So that's a really helpful perspective when you're thinking about energy. This is the graph, and it builds on something that Tiernan showed in his presentation, Victoria's emissions. These are our last, this is the same figure that Tiernan used, 114 million tonnes of emissions of CO2 equivalent in 2016. And hospital sector or health sectors very much using electricity generation, the orange bar, but also direct combustion, burning gas on site for heating and other applications themselves. That's the red part of this bar there. And there's a number of contributions to other elements of this too. When we go to the emissions and where we need to go, it's a fairly stark picture. What I've put up here is a graph from a very recent report just put out in June this year by the Victorian government. This is a piece of advice that was given to the Victorian government by an independent expert panel on emissions reduction. It was chaired by Greg Conway, the former Commonwealth Minister for Climate Change. And the graph shows Victoria's emissions historically up to 2016, because that's the most recent data we've got on the left, the solid line. Then it shows a dotted line projecting our emissions out to 2020. And then it shows two coloured lines out to around 2050. And I'll just talk through this for a bit, because this is really important context when you're looking at energy use and emissions in your buildings. Firstly, in the projected period, the dotted line that goes through that box that says 18% there, what it shows is that Victoria's emissions dropped a bit in 2017. Anyone want to tell me why that was? Thank you. And then it starts to climb again, because without closing that or another coal-fired power station, we actually really don't have anything much on the horizon in Victoria to slow our overall emissions. There is progress in reducing emissions from stationary energy because of the growth in renewable energy in Victoria and Australia. That is a bright spot. That's a fact. It requires, though, coal-fired power stations to close, because you can put as much renewable energy in as you like, but unless they push that coal-fired power out, they're not going to reduce the overall emissions of that sector. So we've got that bumpy line, and that went down in 2017, and it's going to pop up a bit to 2020 due to a lot of burning of gas, a lot of transport emissions, some agricultural emissions. And then the green line and the blue line, what do they represent? The way that the panel approached the question of what should Victoria's emissions cuts be by 2025 and 2030, which are clearly indicated on the graph there, that's the question they were asked, on the way to net zero emissions by 2050, was guided by science-based targets. What's Victoria's fair share of the global emissions budget that remains in the atmosphere to achieve the temperature increases that the community of nations has committed to in the Paris Agreement? So the Paris Agreement says we want to target temperature increase of well below 2 degrees Celsius, and preferably aiming for 1.5 degrees Celsius. At 2 degrees Celsius, we would be following that blue line. And that's not well below 2 degrees, that's 2 degrees. So that's above the Paris Agreement. And it's a pretty sharp reduction. The green line is what the advice suggests we need to follow for a well below 2 degrees Celsius consistent trajectory. And the arrows coming off those lines towards the bottom axis saying we actually have to do more if we want to aim for 1.5 degrees. And I think a lot of people in the room would be familiar with advice from the IPCC that came out last year on what the difference is between 1.5 and 2 degrees. And one of the most startling figures that sticks with me is that at 2 degrees, that's the blue line, very steep cuts in emissions, we effectively lose all coral reefs on Earth, 99% towards the end of the century. At 1.5 degrees, not even a line on that graph, we might retain 30% of them. So there are very significant differences to be attributed to these trajectories, and we have an increasing understanding of the attribution of the amount of carbon dioxide in the atmosphere to temperature increases, and then temperature increases to impacts on the biophysical environment. So that's the broad context that we've got here. We are going to experience, if we're going to have a habitable atmosphere, an unprecedented reduction in our greenhouse gas emissions. Probably not our energy use, because we need energy and we'll find other ways of producing it without producing greenhouse gases. Bringing that then down to the context of a hospital or a site or a health service, I think a lot of you would be familiar with a hierarchy like this about reducing emissions. And a lot of the focus at the moment in the Victorian health sector is on energy productivity and avoiding waste. And also having a strategy, design good buildings when you're building them is part of that. But what we're seeing when you look at the results, for example, for Western Health and its greenhouse gas emissions, is that those things aren't actually going to decrease emissions nearly fast enough to meet our goals as a state at a higher level. So this is a picture of Western Health's total energy consumption by type. Electricity is the dark green bar at the bottom. Emissions from that are reducing slowly as we decarbonise the grid in Victoria. Natural gas is that other green bar. So I'm glad there was a discussion earlier today about heat pumps where you can actually avoid using natural gas because it's nearly half of the energy consumption here at the hospital. But continuing to look at just energy productivity and reducing waste is not going to achieve the scale of emissions reductions that are required to achieve our shared objectives. So I'll go back up to that hierarchy again. Low carbon electricity, or preferably zero carbon electricity, and electrification and fuel switching are essential now, not after we've achieved energy productivity and eliminated waste. They're essential now for reducing emissions on a scale comparable with achieving our objectives. Now, my experience in the water sector said that we achieved a lot looking at energy efficiency, but we're achieving a lot more through zero carbon electricity. And there was a question from Neri a little bit earlier about the use of power purchase agreements, and there was a discussion about it, and a very thoughtful one by Tiernan on the barriers to using them in the Victorian health sector. And those barriers are very real, and I appreciate that. But my suggestion here is that without access to zero carbon electricity one way or another, and I'm not suggesting we try and change the international accounting standards, Tiernan, because we won't. It's not going to happen. It's much easier to do other things than doing that. But without access to zero carbon electricity for the health sector, and without a state government environment that's going to facilitate the support to help that one way or another, we're going to keep fiddling at the edges, and we're not going to be able to reduce emissions in the health sector on nearly a quick enough trajectory. That's a slide we've seen already. I'm going to have a couple of slides of text here before my last slide, and just a point to think about in terms of what can you do and what can people do in the face of some of those rigidities that we see in government from time to time. The Climate Change Act in Victoria says that the Premier and the Minister for Climate Change must determine a greenhouse gas emissions reduction target for the state, and that's the graph I was showing you before, by 31 March next year. This is good news. This is a worthy goal in an act that says we actually have to follow a process to figure this out. And the advice that was given to the state before by the Combay panel was to reduce the emissions by 45 to 60% by 2030, remembering that 60% will only achieve the well below 2 degrees target, won't even get us to 1.5 degrees target. Here's a great opportunity to offer to ministers and offer to the government what the health sector can do to be part of that. It's also something that's very live in government now, and you've got a representative from government talking tomorrow, so it's an opportunity to make your point about what you would like the government to adopt in that regard. But for the hospitals themselves, the government also, for the whole of the government sector, has to say, well, how are we going to reduce emissions by 1 August 2020? This is a statutory requirement and the government has to go public on this. And so here's an opportunity for the health sector to tell this story back to the government and to say, listen, we see what the panel said. We also see by then what you've adopted. We're not going to achieve it without some collaboration and cooperation and contribution from the state, particularly in terms of accessing zero carbon electricity for the sector. So there's an opportunity, and I would encourage you to take it. I think I've got a minute. I'll try and say what I want to in this last slide. Who knows where that is? That's it, Sienna, thank you. Why have I got this up here? This is just an image that I want to use as an analogy for a discussion about what this is here today, all of you people coming together to talk about doing something, greening the healthcare sector, and what the government's trying to do, or what the government's doing. In this image, and this is from the town square at Siena, the tower there represents government. It is the government's tower. And the square represents the public marketplace or the network. And it's really representing two different ways of organising ourselves. One is hierarchical, that's the tower. The other one is networked, and that's the square. And we're talking about, at the Commonwealth of Australia government level, the hierarchy there isn't doing anything for us at the moment to help us reduce our emissions. Yet you're coming together in the square, the network, to try and do that. And in the absence of any activity in the hierarchical structure or the tower, the importance of the network becomes even more so. So the importance of forums like this and efforts like this to find out ways to reduce emissions and to reduce your impacts and to green your healthcare sector are extremely important. And while you're taking that opportunity to find out what those opportunities are, you also have the opportunity to try to infect the town. So my parting word is, it's probably not quite right in the healthcare setting, is it, to talk about infections, but my parting comment is to say, the only activity is happening out there in the market, a bit in the states and in local government too, but in the marketplace, in these networks. Use that, make the most of it, and try to spread the infection while you're at it. Thank you.
Thank you, Michael. We've got a few minutes now for questions, Michael. Fiona?
I attended Victorian emissions reduction target. There wasn't a focus on the healthcare sector, and the advice from the department and the minister's office is that healthcare will be subsumed into other sectors and wellbeing. However, DW studies found that and the report was also about happening by our healthcare at that time that the healthcare plan footprint actually has so free being recorded and if we fail to focus on where the communities are actually further to work here and assume and pretend to us that they're going to be covered in energy plans or public language will need to get to. So it's going to be having advice around that.
Thanks for your question, Fiona. So there are two layers of emissions reduction pledges going on at the state level that you'll be aware of, Fiona. One is your sector pledge, and this is all under the Climate Change Act. The goal of the sector pledges is to give ministers with responsibility for large emitting slabs of the economy responsibility for coming up with a plan to reduce emissions. So the Agriculture Minister will have to come up with a plan there. So I think what the government's saying is that the healthcare sector doesn't figure as a sector in that scheme. But the other layer is looking at the Victorian government emissions, so the emissions from its own operations, which does include the public hospitals and health services. And that is where the organisations that are responsible for that will have to show to the government how they're going to contribute their emissions reduction. What I do know is that work on that is at a very early stage. You're barely there, in fact, at the state government level. And that, Tina might want to add to that. That may not be quite fair in terms of the health sector, but across the government, I know it's really quite early on. This question about where the emissions come from in the health sector, I think it's a really interesting one. The Victorian state government will say, well, public health services are responsible for about 1% of the state's emissions, whereas Dr. McGann's paper says, well, actually, it's more like 7%. That's a huge goal. And there isn't really the thinking within inside the state government. People know about these things one way or another, but there isn't really the thinking to say, how do we drive down those scope 3 emissions? How do we deal with that? So the health sector, in thinking about it like that, is ahead of the government. There's an opportunity there to try to explain, because people don't understand that. I know Tina will, and a handful of others will, but in general, people don't. So there's an opportunity to explain that, to highlight the importance of this sector to the state's overall emissions reduction objectives. And I think that's a really valuable piece of work that we can talk some more about. How do we do that to ensure that that message gets through? Does that answer that? Okay, Fiona? Good. Thank you. Yes. And that may well be the case. And I think what the thinking about the overall emissions of the sector, though, does help us to think about, well, if we think about things we export, increasingly we're going to be exporting to jurisdictions that care about the emissions that were made in their production, as well as if we're importing things, we will increasingly see an interest in the embedded emissions. So it's not really on the Victorian government scheme's radar properly yet, but it's certainly going to become so. And if it doesn't become so, we're not going to reduce emissions quickly enough.
Thoughts? Do you have
Can you explain the connection between climate change and Proud Mary?
Oh, well, Proud Mary is not really connected to climate change, it's connected to me, Rob. Yeah, because big wheels keep on turning. Yeah, yeah. Okay. Thank you for your question. And by the way, I didn't set Colin up for that. Yeah. I would have if I knew you were interested. Yeah. Thank you.
okay, last one.
was the best approach to government.
Yeah.
Because they really need to hear the whistles and need to
Yeah.
know it's quite relevant,
Yeah.
really quite relevant given this scenario, unless we can get that message further.
Yeah.
And
Yeah.
how best is up in place to administer that message.
Sure.
Infection.
Yeah, sure. Well, look, we can see that the Minister for Health is already a little bit infected from what she said in the Public Health and Wellbeing Plan. I mean, I include that there because I think that's a genuine bright spot, that understanding about the connection. I think that and coming from that environment, and Diana's in that environment as well, the amount of stuff that the small number of people working on this have to get through is enormous. And so the tendency is to become very focused on what's in front of you. And so if there's a slightly more sophisticated narrative about something that's going on that isn't easily accessible, you won't access it and you'll skip along. All those people are very thoughtful, intelligent people who will understand this at a level, but you'll filter it out at work because you've got so much else in front of you that you need to attend to. So I think part of it is trying to simplify and show the difference between, for example, Force's work and the Victorian government's assessment of things, and show that very simply, and to engage as broadly as you can across government. And so the Climate Change Minister will be thinking of how we can achieve this, but the Health Minister is a fantastic target for engagement on this, to be able to go and say, look, we can help you achieve your goals, and we've given some thought to this, and we'd like to do that. So there's an opportunity there. But that clear communication is part of it, but engaging more broadly is another part of it, I think, too. Thank you.
Thank you, Michael. In addition to being an expert in your field, it seems you've also invented a Scrabble word for all of us, ferrendogram. There are many concerning images you showed us today with your presentation. You also left us with a sense of hope and inspiration. So join me in thanking Michael for his presentation. Welcoming now Sven